Hi, Kaylin. Today we're going to perform an eye exam. To begin, if you can just stand, I'm going to assess your visual acuity by having you read the lowest line that you're able to on our Snellen chart with the left eye covered first. So are you able to read the lowest line?
DEFPOTEC.
And then cover your right eye.
DEFPOTEC.
And then with both eyes uncovered.
DEFPOTEC.
Alright, so if you can sit back, I'm going to assess your near vision. So I have the card, and normally I would do the same. I'll have you read with left eye uncovered, left eye covered, and then the right eye covered, and then both eyes uncovered. And that's what we're gonna do is for you to read the lowest line that you're able to, and my card is about 14 inches away.
LTFPH.
And you have 20/20 vision. So next, I'm going to assess your peripheral fields. So if you can cover your right eye, and I'm going to cover the same side, which is my left eye, and let me know when you see my hands or finger.
Now. 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 Now.
And I would do the same on the opposite eye. Next, I'm going to assess extraocular function. So I'm going to first perform the corneal light reflex. So I'm shining the light, and the light reflex is symmetric. Next, I'm going to perform the cover test. So if you can cover one eye at a time, and I'm trying to assess for any nystagmus or lid lag. And if you can switch and cover the opposite eye, I will do the same, noting for any nystagmus or lid lag. Next, I'm going to assess for extraocular movement. So if you can follow the direction of my finger without moving your head. Okay, so your extraocular movement is intact. Next, I'm going to inspect the eye, the structures. I'm looking at your eyebrows, your eyelashes, your lids are not inflamed, your eyeballs are neither protruding nor sunken. I'm just palpating the lacrimal apparatus. Does that hurt?
No.
Okay. And then I'm inspecting the conjunctiva. So if you can just look up and look down. All right. So the conjunctiva is clear. His sclera is white. Next, I'm going to assess the pupils. Okay. So if you can just look behind my shoulder. So the pupil react, and I'm going to repeat the motion, checking for indirect reaction. And I'll do the same on the opposite side. Okay, and if you can just look at the light, and I'm bringing this closer to you with just following with your gaze. Okay, so the pupils are equal, they're round, reactive to light, and accommodation. Next, we're going to perform the fundoscopic exam. So this entails me looking at the back of your eye. Normally, we will have the room darkened, but for the purpose of demonstrating how to use the ophthalmoscope and perform the fundoscopic exam, we will be keeping the light on. So I'm going to examine your right eye, and I'm going to use my right eye as well. So I am going to approach at an angle, try not to blink, and once I've identified the red reflex, I am going to work my way closer, and I'm going to examine the general background, the retina, the optic disc, the vessels, as well as the macula. Okay. All right. So that concludes our eye exam. Do you have any questions for me?
No.
Thank you, Kayla.